Okay, I thought so. Your name's on the top. It's the second author. One of the statements in this says, quote, in addition, HHS and USDA have prioritized health equity as the central lens through which all scientific questions will be considered in the 2025 DGAC. Do you think that that makes sense?
That was the request from the administration, and that was carried in through the charge to the committee.
But do you think that this is a proper way to go about promoting nutrition?
It is one of the discussion points that, it's one of the topics that is being discussed.
Well, I'm asking if you think that this is a proper way of going about promoting nutrition in the United States. Your name is on this article.
Brandon Gill came into this hearing with one simple question, and the witness struggled to give him a straight answer. Gill challenged the idea of making health equity the central lens for America's nutrition policy. Then he brought up an article with the witness's own name on it. But when Gill asked whether the policy was actually appropriate, the answers kept circling back to the previous administration. Then the questioning got even tougher. Gill raised concerns about potential conflicts of interest involving a dietary guidelines committee member with ties to plant-based advocacy and funding from Beyond Meat. The witness repeatedly deferred to ethics officials and legal counsel. And that left Gill with a bigger question. If government officials are helping shape national nutrition policy, shouldn't the American people get clear answers about the ideology and the potential financial interests involved? This exchange was a sharp reminder that accountability matters, especially when government recommendations can affect what millions of Americans are told to eat.
Thank you, Mr. Chairman, for hosting this hearing, and it's good to know that we have an administration that is prioritizing making America healthy again and fighting for children who want safe, healthy food and for Americans. And I think that that's refreshing, so we really appreciate this. Dr. Studi, I've got a few questions for you. First of all, what is health equity?
It's the consideration that all individuals have equal access to healthy foods or different aspects of the health system.
I think all individuals should ideally have access to healthy food. Do you think that that should be the central lens through which we look at health?
It is certainly an area of research and discussion.
But the central lens, do you think that makes sense?
You're relating to the work of the 2025 Dietary Guidelines Advisory Committee that the previous administration did ask them to conduct their review of evidence with a health equity lens.
Well, are you familiar with this article entitled, it was from the American Journal of Clinical Nutrition. It's called Addressing Misinformation About the Dietary Guidelines for Americans?
Yes.
Okay, and were you an author of this article?
Yes.
Okay, I thought so. Your name's on the top. It's the second author. One of the statements in this says, quote, in addition, HHS and USDA have prioritized health equity as the central lens through which all scientific questions will be considered in the 2025 DGAC. Do you think that that makes sense?
That was the request from the administration, and that was carried in through the charge to the committee.
But do you think that this is a proper way to go about promoting nutrition?
It is one of the discussion points that, it's one of the topics that is being discussed.
Well, I'm asking if you think that this is a proper way of going about promoting nutrition in the United States. Your name is on this article.
My perspective on that is I think it's good to look at evidence in all ways, and that can include through that perspective.
Do you think it should be the central lens?
I did not. That was the request from our administration.
But you don't think that that's
is the charge?
You don't think that that's proper?
I didn't write the specific charge to the committee.
Well, your name is on the article.
Yes, and the article is talking about what the request was to the 2025 committee.
And I'm asking you if you think that that is a proper lens to view nutrition through.
I think it is a lens that you can view nutrition through.
But is it a proper lens? Well, this says central lens.
Again, as a career employee in the Department of Agriculture, I implement the requests of our administration, and that was at the time with the Biden administration the request.
Right, but we have a new administration with different priorities that don't include DEI and health equity? Do you think that this is a proper way to view nutrition?
I think it, as I've mentioned, that it is appropriate to look at literature in every.
So you're not going to answer the question respectfully. We can move on then. I would thought that would be a simple one. You're familiar with the scientific report of the 2025 Dietary Guidelines Advisory Committee, is that correct?
Yes.
And you're familiar with the members who wrote that, who were on the Dietary Guidelines Advisory Committee, right?
Yes.
Got it. One of the things in this same article, which you wrote as a bit of you said misinformation, which you're attempting to dispel, is that there are no conflicts of interest. Is that correct?
The discussion is that conflicts of interest was considered in the process to establish the Dietary Guidelines Advisory Committee. I think conflicts of interest, whether real or perceived, is an extremely important conversation in nutrition science.
Right. One of the members of that committee is a man named Chris Gardner. He's a practicing vegan. He's an environmentalist activist. Receives funding from a company called Beyond Meat, which is trying to run cattle producers out of business, wants to move towards plant-based diets. Do you think that that's a conflict of interest, that he is on this panel advising the United States in an official capacity about what foods are nutritious and what aren't, whenever he has a obvious financial interest in Beyond Meat?
I'm not, I will say that conflicts of interest were reviewed by
I'm just asking if it is a
Office of
conflict of
Ethics
interest.
within the Department of Health and Human Services who chartered the committee. I think that those things should be disclosed and discussed. And the department, the administration was aware of those affiliations.
So that is a conflict of interest. Is that your testimony?
I'm not an attorney in ethics.
Neither am I, but it's pretty obvious, isn't it?
Well, if you're talking about a financial conflicts of interest, that is something that our ethics attorneys review and assess. So I do not do that review of our members in that process. We do have individuals who support.
So your testimony is that you don't know if this is a conflict of interest or not?
Well, I will say, I mean, there are processes, and I think part of what the
It's just a yes
conversation
or no
is
question.
with MAHA is should those processes be stronger?
Right. It's just a straightforward yes or no question. Is this a conflict of interest or is it not?
It could be
That somebody
perceived
who
as
is
a conflict of
advising
interest,
us
yes.
on what is
also
nutritious
say-
food has a financial interest in a business that is trying to run cattle producers out of work.
I will say that is reviewed by our legal counsel
I yield my time back. That's
looking
fine.
at conflict of interest.